on the film. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Probably the most unorganized therapist on the internet, too. Wouldn't you say, Brad?
Yeah, but we still get her done, Bob.
Yeah. Today we're going to talk about 3 never-to-do treatments for sciatica, and we're also going to show you how to fix it the right way.
Right.
So these are, I see people sometimes, they get thoughts in their mind about, well, I'm getting pain all the way down my legs, so this is what I should do to treat it.
Right.
And it ends up being the exact opposite of what you should be doing.
Precisely. As a matter of fact, I was just working with I wasn't working with him, I was at a track meet. And he says, God, I got this pain down my leg, and he says, I better stretch it out.
Yeah.
So he does the number one thing. Should we wait or invite our guests
Well, let's
first?
invite the guests first. We got to keep them hanging for
Hold
a second.
on, we're going to show you this number
one thing. If you are new
thing.
to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook and like us, because Brad and I, as children, it's Bob and Brad, we're not liked, but we're turning things around. We got a few people that liked us yesterday, Brad.
Oh, good.
On Facebook, yeah.
They're nice people.
All right, so what is the number one thing that you should never do?
People think, well, we got to stretch things out.
Got to stretch your back and got to stretch the legs.
Yep, stretch it out. When, particularly if your sciatica, which oftentimes is a result of a disc problem, a bulging disc or herniated, you do that, and more than likely you're going to exacerbate the problem, make it worse. So
absolutely, and if you want to even make it worse yet, bend and kind of twist to one side. You know how they do sometimes where they grab one leg like that?
Right, because you want to stretch that hamstring out where
Right.
that pain's going down. But the pain is not from the muscle, it's from the nerve. And so...
which is coming from the back.
Right.
So, I mean, it's just, trust us on this one. You are making things much worse.
Right. There are certain cases where it might be that, but we're talking about the majority.
If there's like a adhesion on the nerve.
Right.
But that's, you need to have a therapist diagnosis. And believe me, if I'm a betting man, I'm betting that you go the other way most cases.
Sure.
So.
Okay, that's number one. What's the second one?
The second one, Brad, is the hurdler stretch.
Right.
You always show this well, Brad.
Well, there's different ways to do the hurdler stretch. One is actually like this.
Right.
Oh my goodness, I don't do this one. And then like this. And it does a really nice job of stretching the hamstring, but it also doesn't do a good job of your back.
Yeah,
in
you're
this
putting
situation.
pressure on the back again, putting pressure on the disc again.
And this is even worse. This even actually flexes
Yeah.
the lumbar spine more. It doesn't stretch the hamstring as well either.
So even doing this and bending forward would be worse too.
Right, that's all.
I'm pretty tight myself here, aren't I?
Yeah.
I work on my hamstrings a lot, but I mean, I get up to 90. So you seem like you doubt my veracity.
No, I don't doubt anything you say, Bob.
All right. The third one, Brad.
Massaging the leg. If the leg hurts and it's that numbness, especially if it's numbness, tingling, all those sensations, is very clearly a nerve problem.
Right.
And if you massage it, is it going to make the source better?
I wouldn't say that this is one that makes it worse, but it's not going to help.
Right.
Right. I mean, and generally, with the rule of thumb with massages, to me anyway, is if you're like pushing on the leg and there's no pain there, it's not tender from pushing.
Right.
Then the muscle's not involved. Then the massage isn't going to help.
Right.
So I mean, again, even up here, sometimes people get referral pain into the upper trap, and I'll push on you, and they're like, no, there's no pain there. But they feel pain there from the nerve. Right. So the massage isn't going to help. So
and this can get a little tricky.
It can.
So as therapists, it's more clear to us than the layperson. So we've got other videos that if this doesn't make sense, go to the other ones that show.
To go into greater detail.
Right. Yeah. You bet.
But we want to start off with the 3 things you should never do, and now we'll kind of give you some things and show you why you want to not do those and go into the opposite direction, basically.
Right. Right.
So you want me to start one?
Yeah, because you know me, that doesn't agree with my body.
So you're going to start off with extensions, and this is a lot of times even just regular old back pain. Sometimes a lot of people want to start off with this way, but especially with a sciatica problem, some people actually have to start, they can't even lay in this position. They have to lay with a pillow underneath them. You want to give me one, Brad?
Let's clear the gap. There you go.
Now, 1 pillow, maybe even 2 pillows sometimes they have to start off with, and they just start off with this, and this is the treatment. It's easy, isn't it? You just lay.
Now, if you lay like this, you put a pillow under there and things start to feel better in the leg already, which I've had happen many times, you know you're heading up the right
You
pathway.
want to describe that a little more, Brad? What they're supposed to feel? What are we? What's the end goal
So
here?
you've got sciatica, pain is running down the leg to the ankle. You lay on your stomach, and it still hurts, but you put a pillow under here, and it makes it feel. Then it becomes comfortable, and you lay there for a minute or two, and all of a sudden the pain in the leg starts to dissipate, particularly down here. And I've had this happen many times. I'm sure you have too, Bob. Where you know, and I'll just talk to the patient a little bit about what their kids are up to or whatever for about a minute, and I say, "How's your pain in your leg now?" And they say, "Well, I only feel it from the knee up. I don't feel it in my foot anymore." Boy, then you know you're doing the right thing.
Yep.
Then you can start some press ups. You're gonna.
Or you can actually, you might start off then going to the point of taking the pillow out,
Right.
or you might put your up on the elbows here with a prone prop.
You just continue to monitor, and this is one of the things that you kind of vary, and it varies a little bit from person to person. But if you can take the pillow out and go to this position, and the leg starts feeling better yet, boy, things are really going in the right direction. You have a really good prognosis for improvement.
Now, if you go up in this position and the leg pain comes back, then you have to go back down again.
Right.
And maybe try that for a day. Eventually, you want to get up to the point where you're starting to do press ups. So you got your hands underneath your shoulders.
Yes.
And you're pressing up like this. Same thing you're looking for. You're looking for the pain to be traveling up the leg in a sense. It's going out of the leg and it's going into the buttock and maybe even into the back. Could even be getting a little worse in here. But as long as it's going out of there, that's a great sign.
You bet.
There's your sign.
Where does that come from, Bob?
That was that one comedian. He always says, "There's your sign."
I heard that. I don't know if I ever saw him. Now, if you want to get a book about this, you want to get Mackenzie's book, How to Treat Your Own Back. We have it here normally in our shelf, but I don't because literally one of my patients is using it.
He just borrowed it out.
He borrowed it out. It's going to come back, I hope, anyways. So this is one for the neck, but it goes through this whole treatment so you can follow it on
They really
paper.
explain it well. I mean, they do a really good detailed
Right,
job, and it's
right.
for the layperson. So, Brad, should we talk about some of the variations you might have to do
Yep,
in order to?
right.
So let's say you're trying all this stuff, and you're getting here, and it's just not going out of the leg. So now, one thing you might try is what we call making yourself into the banana. So I'm going to shift my hips over. This is the painful side. So I'm going to actually shift my hips to the right and my legs to the left. So I'm forming a banana.
So the banana means if you're looking from the top, from the ceiling down, he has a curve this direction, so it kind of looks like a little banana. And then you keep your body like that while you do a press up. And actually, after you do that, and I'll have results, you do the banana shape, and all of a sudden the leg starts to feel better even before the press ups.
Yeah, because you just put it in that position.
You bet.
So if it was the right leg, I would move my hips to the left,
That way.
shoulders to the right, legs to the right,
And the bananas
I got
the
the
other
bananas
direction.
that way.
If we had a camera from the ceiling, it'd really be nice, Bob.
Yeah, Lonnie, get up on the ceiling here. What are you doing there?
Well, we don't want any injuries, Bob.
All right, now how about the pillow underneath the, how about the towel underneath the pelvis, Brad? That might be a little thick.
Yeah, it is, but then you can see it
So
better.
you can just take a folded towel and
Here.
There we go. That's better. You don't have to roll up, but you can just fold one. I just fold one sometimes into like a quarter.
All right, we'll fold one up, Bob.
Won't get it yet right. This is how I do it. And so I'll put it underneath the side, and then I'll try a press up.
Sure.
And I've had luck with this before.
Yep.
So it's amazing. You try these little details. You're trying to find what works.
Yes.
In essence, and that's where you go with it then.
Do you want to show them roadkill?
Sure, roadkill, yeah.
Yeah, this is one that, as a matter of fact, just in the last couple of weeks, I had someone, I was having her to do the press ups and whatnot, and I said, bring your knee up just like Bob did. And as soon as she did that, it started to feel better. And it's like, oh, now we're getting somewhere. And I've had this a number of times.
So now I'm going to go ahead and try to do press ups that way. Another third variation you can try.
Again, you're only going to proceed with each of these individual ones is if it clearly makes the leg feel better. And
Right.
overall, things are getting better. Clearly, it's not like you're going to push through a bunch of pain and hope it gets better.
And we should talk about how often they can do this, Brad.
As long as you have good success with it, it continues to make the leg feel better and the pain centralize or go up towards the buttock in the center of the back. You can do them every hour. About 10 repetitions. You're not going to do them for 30, 40 repetitions. But if you can do it every hour, 10 repetitions. And honestly, if things are centralizing and going very well, you're not going to be able, you do that for a day or two and you'll be able to drop it down because you'll be doing much better.
I've actually had people, patients that I've had them bring cardboard with them to put on the floor because they worked on a factory. And they'd lay on the cardboard and do it, on their shift every hour.
Oh, I thought you were...
Well, where did you think I was going with
Take
this,
the
Brad?
cardboard and go sledding down the hill in the winter.
Oh yeah, that's what I intend to have my patients do, to have them go sledding. So remember, Brad and I can fix just about anything
Except for...
a broken heart. We fix broken backs, we fix sciatica.
Really afraid to go into flexion, aren't you, Bob?
Yeah, I am. So, thanks for watching.